Hello again, everyone. My name is Marty Guthmiller, and I am CEO at Orange City Area Health System, bringing you today the 75th edition of our COVID-19 community briefings. As today is a Monday, we're going to start off with a local scoreboard, and I'll offer as much local insight as I can relative to what's going on here in Orange City, and certainly then also around the state as usual. So let's just start, jump right in. Our local scoreboard, we have had 1,509 positives of the 7,315 tested. That is a rate of 20.6%. Comparatively, we were at 20.0, 19.7, and 17.8. So we are still going up. It's a little disappointing after last week with maybe a trend down a little bit, but nonetheless, we are at 20.6%. Our last briefing, by the way, was last Tuesday, November 24, and I'll be referring to that periodically as well. For this last week, actually 6 days then, we've had 95 positives of the 244 tested. That's at a positivity rate of 38.9% locally. Again, disappointing after last week at 23.2, but the week before that we were at 40, and the week before that we were at 56.7. So back up from 23 now to 38.9% for the week. Sioux County, 3,709 positives of the 11,895 tests conducted. That's a 31.2% positivity rate. Compared to previous 30.7, 29.5, and 28.8. So same as locally, Sioux County continues to climb a little bit. The 3709 does represent 165 new positives since last Tuesday. On the 14-day average, some encouraging news there. Sioux County is now number 13 in the state at 23.3%, down from 26.3, which is down from 30.0, which was up a little bit from 29.7. So the last four reports that we've given for Sioux County, 23.3, 26.3, 30.0, and 29.7. So clearly, we are lower than we've been, but still fairly high as number 13 in the state. Lyon County is the new number 1 in the state at 31.3%. They were previously at 34.2, so they did drop 3, but did climb in the rankings. They were at 31.7 previously and 23.8 prior to that. Number 9 in the state is Plymouth County at 24.2%. They were previously 25.9, 31.1, and 28.9. So Plymouth County at 24.2 is number 9 in the state. O'Brien County is number 47 in the state. At 19.4. So they did go up from 18.9 to 19.4, but they're still 47th in the state. There are 97 of the 99 counties in the state at a 10.2% rate or higher. In terms of Region 3, the 20 counties in Northwest Iowa, we currently have 205 hospitalizations in those 20 counties. That is identical to where we were last Tuesday at 205, and prior to that was 218, prior to that was 183. There are currently 45% of beds available in the 20 county area, so that is not a concern currently. We do, however, have 41 ICU patients in Region 3, and that's compared to 37, 38, and 32. 24 of those 41 patients are on ventilator support. We do have currently 78% of our vents available in the 20 counties, and that's the number on that is 91. There were 23 admissions in the last 24 hours. So again, by a number of different measurements, this thing isn't over. Moving on to the state of Iowa, 228,996 positives of the 1,211,086 tests conducted. That rate continues to go up. It is 18.9% compared to 18.3, 16.9, and 15.9. Yesterday, as an example, we were at 22.5%, but that's only one day. But we'll see what happens with that. So Iowa continues to climb statewide at 18.9%. The number of hospitalizations, the number of Iowans hospitalized, I should say, is at 1,175. That is down from 1,333 last time we talked versus 1,279. So we've dropped, and that's a good thing. That does include 56 people who are hospitalized out of state. Sioux County is now number 30 in the state with hospitalizations, and that's a good thing at 10. I'm going to give you some percentages here in just a second too, but we'll go through the normal inpatient hospitalizations first. So Sioux County's at 10, previously at 11. Plymouth County at 13, previously at 13. O'Brien County at 6, previously at 9. Lyon County at 3, previously at 7. Woodbury at 59, previously at 49, so they're up 10. Polk County 126, down from 137. I thought it would be interesting because these are gross numbers. So these are just raw numbers, and they don't take into consideration the population size. So as an example, the Polk County at 126 represents 0.026%. So that's 0.00026 of the Polk County population is currently hospitalized. Sioux County, interestingly enough, at 20th in population is 0.028. So Des Moines or Polk County is 0.026%. Sioux County is 0.025. And I thought I was onto something because there was another state that was close to that, and I'm not seeing it right now. Lyon County. Lyon County was 0.025. So it's really interesting. Sioux County 0.028, Lyon County 0.025, Polk County 0.026, and those are in percentages. So it's 0.00026. But when you look at some of the other counties around us, that consistency goes away. Plymouth County is 0.051% of the population. O'Brien County 0.044%, and Woodbury County at 0.057. So Woodbury, O'Brien, and Plymouth seem to be fairly close, more in that 0.0005 range. But again, it gives you an idea of the vastness of this virus in terms of affecting a population. And even though those percentages are very small, they still have a huge impact on the ability of the health systems to care for people appropriately. And that's why that's the whole thing about flattening the curve, is not to prevent infections, but to flatten that out so that even at those small numbers, we can handle it in the health system perspective. We have had 179 additional deaths since last Tuesday. Sioux County currently has 25 officially. A little bit of a change in the demographic, but to the older population. We now have 93% of the population is over age 60, And 80 plus is 53% of that death count. Still, there has been no one under the age of 30 that has passed away from COVID or COVID-related symptoms. That's a review of the statistics. I'm just going to give you a couple quick things regarding some things in Orange City. Our lab, for example, has done 421 tests with 1 day to go in November. 169 of those were positive. It's a 40.1% positivity rate. As an example, in October, we had 132 positive of 405. So pretty similar rates there. We continue to test our staff at Prairie Ridge, our retirement home, our retirement nursing home, twice a week. And we continue to test our residents weekly, as is being mandated according to all of the IDPH and CDC. Those are all, we're meeting all of those requirements. Our testing kits are well supplied. We have plenty of them. And I continue to be blown away by the discipline of our staff in the nursing home and the resoluteness of how they are addressing that situation. On the hospital side, it has calmed down significantly. Currently, as of this morning, we had 9 patients in-house, that's all. 0 of them COVID. We haven't been able to say that for months. And so we had 0 COVID patients as of first thing Monday morning, 9 total patients. Average activity over the weekend in our ER with no COVIDs. No COVIDs in our ER this Saturday or Sunday. And so that certainly is encouraging news, more so than the number of positives that we had. So we have to be careful of that these number of positives could still manifest in the acuity that we don't like to see. But thought I'd give you a pretty good, that's a feel good for this 75th briefing. Our walk-in clinic had kind of a normal weekend at 22 visits over our 2 days this weekend, very normal. Our PPE is in good supply. And so all in all, things were very quiet over the weekend. And things are well staged for this week. So we feel good about that. You've heard a lot of talk about the vaccine. And certainly that's a very good thing and very welcome for all of us. Just nobody knows exactly when it's going to be, but the FDA is meeting on December 10. It's expected that these emergency use authorizations, or the EUAs, will be offered shortly or on the 10th. And so distribution could begin soon thereafter. Most likely, there will be 2 doses required, not sooner than 3 weeks apart, but there'll be much more information coming on the vaccines. Stay tuned to this source, and I'm sure there'll be other media announcements as well, as the vaccine is to be distributed most likely in the next couple of weeks. Nobody knows exactly where these are going. We've heard things about going to high population areas. We've heard things about going to priority areas. We don't know that yet, but we will get that information very soon and distribute it as soon as we can. Obviously, it's a very fluid situation. Everything on our end is done in terms of the paperwork and signing up. We're staged and ready to go when it happens. So be confident in that. That's it for today. We are still in the midst of this battle. There's no question about it. The positivity rate is still high, but we are beginning to be able to live with this a little bit better. I hear good reports from the schools, and so we just have to hang in there a little bit longer. So the vaccines will be kind of the next big news that we have, and we'll get that out as soon as we can. So again, that's it for today. I want to remind you and encourage you to stay strong through this. stay vigilant. Continue to wear your mask, all the hand hygiene stuff, and social distancing, all those kinds of things. Continue to do that. That is helpful. It is not going to stop everybody from getting it, but it will reduce it. And so continue to do those types of things. And above all else, stay healthy, and hope you had a great Thanksgiving. And we look forward to the Christmas season ahead. So thank you for joining us. We will anticipate a briefing at the end of this week as well. Thanks again.